Tony Stein is the Chief Executive of Healthcare Management Solutions. They've got tons of places. Hello, Tony. Morning.
Good morning, Andrew.
You've got how many facilities do you have? How many homes?
70 around the UK.
That's a very, very big business indeed. So you've got 70 homes. What's your policy on vaccinations?
Well, from the outset, Andrew, our policy was always that we would direct and encourage and inform our staff and help them to make the right decisions about being vaccinated. And to be fair, it worked out really well. The vast majority of our staff opted to be vaccinated quite early on. Obviously, we're now in a position where we're being told by the government that it's a mandatory issue for existing employees, which we never wanted to happen, but here we are. And as a consequence of that, we'll probably lose 36, something like that, 36 members of staff by the time we get to the 11th of November. Obviously, we've still got the option of receiving some medical exemption certificates, but it's about that number.
So 36.
But out of 2,000, that's out of 2,700 staff. So
okay, so that's fine. So you you started an education process around this. What are the reasons that those 36 give you for not being vaccinated? And I accept the fact that they might have a medical exemption, but what reasons?
No, so those 36 are people without, as far as I know, without medical exemption. So the main reason, well, there are two main reasons. One is a genuine fear, and some people, for whatever reasons, they've had whatever information they've received through social media or through friends or through wherever it is. They've received information that makes them scared or worried about being vaccinated, and I get that. It's easy to assume that they're in some way lacking intelligence if they make that decision, but that's not right. People genuinely have a fear of it, and I think the other reason is that people are taking a very principled stand about it, which is, we shouldn't be forced to be vaccinated. It's just wrong. It should be our decision. And those are the two main reasons, I think.
Are you going to be legally required to let people go, to hand them their papers and say farewell? So you're going to have to, on government diktat, you're going to have to sack people if they've not been vaccinated? Yeah. That's an amazing situation that we're in, isn't it?
It's a difficult situation. I mean, we've laboured many years now under a sort of a staffing issue in the care sector, trying to find nurses, trying to find carers. Even now we're trying to find, struggling to find catering staff and domestic staff. And the reasons of that are manifold and complex, but, it's an ongoing problem for care operators. And this is only going to make it worse. Do you remember, it's not that many months ago, Andrew, that the government said that provided that 80% of the people in the care service were fully vaccinated, that would be sufficient protection for those residents and staff that work in the home. So now we're being told that everybody has to be vaccinated. Of course, it doesn't count for visitors as well. Visitors can come in, but provided that they test negative, they're fine. Our view would have been that those members of staff. And remember, this isn't a black and white situation. I think over time, those people who are scared of being vaccinated, who are seeing their colleagues and they're seeing their friends and family being vaccinated and everybody's fine, are becoming less and less worried about it, and they'll become more and more inclined to be vaccinated. So I think to bring a sort of guillotine down and tell us that by a certain date that we had to dismiss people who were working for us already, who weren't vaccinated is quite draconian, really.
Yeah. Tony, thank you for your time this morning. Tony Stein, Chief Executive of Healthcare Management Solutions. They've got 70 facilities, 70 care homes and 2,700 staff. It's a very big operation. Are you one of those people?